more than 5 million Americans, including 14,000 in Delaware, suffer from Alzheimer's. The aging of the baby boomers who begin turning 65 next year will rapidly increase the number of patients who suffer from this devastating disease. Today, there is no cure for Alzheimer's, there is no vaccine to prevent it, nor medicines to cure or even delay its onset or severity. Joining me now to discuss this is AstraZeneca Vice President, Dr. Frank Casty. Dr. Casty is also the co-chair of the Coalition Against Major Diseases. Welcome, Dr. Casty. How are you?
Thank you. Thanks for having me.
You've worn many hats throughout your professional life, among them medical doctor, manager, and executive, and now you're the industry co-chair of the Coalition Against Major Diseases. Can you tell us what CAMD is?
Sure. CAMD is an international coalition focused on advancing new medicines for the treatment of chronic neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease. And we do that in a few ways. One way is we identify characteristics that might predict if patients are going to go on to develop Alzheimer's disease, and the other is we develop tools and methods that could hopefully slow or even prevent the onset of Alzheimer's in the first place.
So what would you say makes CAMD unique?
Well, I think its first fact is that it's not happening all within one pharmaceutical company. CAMD is a collaboration of many partners, as you mentioned, 12 pharmaceutical companies and 7 patient advocacy organizations, as well as collaborating with various government organizations such as the National Institutes of Health, the National Institutes of Aging, as well as the FDA and the European Drug Regulations Agency. So it's very unique in that we've got the right stakeholders around the table, all of whom have a common goal of accelerating new medicines for the treatment of these really difficult, chronically complex diseases like Alzheimer's disease.
So what is the purpose of CAMD?
Right, the purpose is really about creating these tools and methods. And in order to create those tools and methods, one of the things that we've done, which is truly unique, is to pull together the data from multiple sources across pharmaceutical company trials. So the 11 trials that we've talked about normally would have been created within separate databases that literally couldn't talk to each other. What CAMD has done was create data standards so that those databases can now talk to each other and we can exchange information. As a result, we've created a database now of over 4,000 patients with Alzheimer's. That's a tremendous achievement in and of itself because no one company or government agency would ever really have been able to do that scope of a trial on their own. It would have taken too much time, too much cost and effort. But by virtue of the collaborative efforts, we actually can take all those individual efforts and make it into a more meaningful, a bigger impact. Once we have that data, which we've now achieved, we can now develop tools and methods that will actually make drug development more efficient. So when the next company or the next government agency comes along with their new medicine, there's going to be a framework and some tools which doesn't exist today that'll actually make it much more streamlined, more efficient, and enable us then to bring medicines more efficiently, more effectively, and more safely to patients who need them most.
What role do you play in CAMD?
Well, as industry co-chair, I'm there to really enable and ensure that the collaborative effort is rich. And we've created a culture and a spirit that's really very exciting because we brought together a lot of people who you might think have different kind of goals. Federal agencies, researchers, academics, and pharmaceutical industry. But we all have the same common goal, which is to really deliver new medicines that make a meaningful difference in patients with Alzheimer's so that they can live their lives more fully. So creating that atmosphere and this type of arrangement, I think you had Congressman Gephardt on just a few months ago, and he mentioned the value of public-private partnerships. AstraZeneca is proud. CAMD has only been in existence for about 2 years, and AstraZeneca has co-chaired it from the start. We're very intent and place public-private partnerships at a highest priority for our research agenda, because as we look in the 21st century, the diseases we're tackling are much more complex. They require more sophisticated, more collaborative arrangements, rather than thinking you can do it all just in one laboratory. Those days are gone, right. And so we're very proud to be part of that.
How can you achieve your objective and help find a cure for Alzheimer's?
Well, first, at the foundation of our success has been the ability to aggregate data, and lots of it. And as I mentioned, we have now 4,000 patients over about 2 to 3 year period, a very unique data set. And we had a very nice achievement just a few months ago when we publicly released this. And the other aspect of CAMD is not only do we have the database, but one of our principles is that we will be transparent, meaning we will share the data openly and freely with any academic researcher who wishes to access it. So you can go to our website at cpath.org and researchers can access it because we want to engage the broader worldwide community in developing cures. Remember, we're developing the tools. We don't have a specific medicine.
Right.
These academic researchers have now accessed it, over 200 individual academic researchers in just the past 4 months alone. So there's a tremendous need for this, and we think a lot of fruitful research is going to come from that.
Is CAMD a for-profit business?
CAMD is not for profit. We're part of a larger organization called the Critical Path Institute. Critical Path Institute is funded first by a grant from the FDA, but also a matching grant from the Science Foundation of Arizona, where Critical Path Institute is located. So we largely, most of the organizations that are participating deliver what's called in-kind support. They're sending their best and brightest scientists to the table to collaborate to come up with these innovative tools that are going to improve the drug delivery process.
And Dr. Casty, tell us what's happening in Delaware. You work here, right?
I do. I work at AstraZeneca, and AstraZeneca and local Delaware agencies have been very engaged with CAMD. We're proud to have some significant research being conducted through the University of Delaware, but also Delaware Biosciences Association. They've already been engaged with CAMD. We've got a terrific culture here and an environment for biomedical research in the Wilmington area. We've got a governor who supports medical innovation. We've got the right infrastructure, the talent base. So there's a lot of terrific opportunities for local Delawareans to really get involved at all levels in the Alzheimer's research.
Dr. Casty, can you give us a specific example of a tool that you're currently developing now?
Of course. One of the areas that we talk about a lot is the area of biomarkers. A biomarker is simply a measurement that correlates with disease. And through this database that I've discussed, we have a real treasure of data that's involved. Clinical assessments of patients, blood work, imaging, MRI scans of the brain, as well as genetics. So we can take a look at that data and try to use those data to see if it correlates with the progression. The other piece of this, of course, is the modeling piece. And when you have 4,000 patients, the quality of your data is much more enhanced. And when you have it over a few years, that's even better because for the first time, we can now understand more fully what's the natural progression of Alzheimer's disease, something you may think we already knew, but this database actually helps us better understand that. So there's a modeling piece and there's the biomarkers, each of which will help us design better clinical trials in the future.
What kind of challenges do researchers face trying to get people involved with different kinds of studies?
Yeah, well, first I think is probably having the kinds of tools that I've just talked about to enable them to see their research to fruition. But I think more fundamentally, we really want to encourage patients and their families whenever possible to participate in clinical trials. There's many ways you can do that, and the benefits, of course, can be that we add, of course, to the quality of this database, which is continually updating and getting even better and better as we go along. So patients and their families who may be interested can go to any number of websites, two of which that we frequently look at are clintrials.gov and the National Institutes of Aging, nia.nih.gov. This is a part of the National Institutes of Health. And so both of these websites can provide patients and their families with many resources for support for Alzheimer's disease as well as research opportunities.
Can you tell us short-term and long-term, what kind of goals are we expected to reach?
Sure, it's a great question. As I said earlier, Alzheimer's is an extraordinarily complicated disease. We've done decades of research on the basic science to really fully understand it. But of course, today's therapies really do fall short of a preventative or a cure. Most of the therapies today treat symptoms and then only modestly for short periods of time. So we have an enormous unmet need. Alzheimer's, by the way, is also expected to increase 50% in the next 20 years. So that 5 million that you mentioned now will go to well over 7.5 million. That means that we have a great deal of urgency in terms of delivering some very practical results. With respect to CAMD, we're engaged very closely with getting some of these tools that I mentioned, the biomarkers, approved so that researchers can immediately begin to make new clinical trials that are more efficient and effective to get their medicines through. But I do think that it's also important to say that there are nearly 100 medicines still in development, and so there are still many opportunities to actually develop a new treatment for Alzheimer's disease. AstraZeneca is clearly interested in this area. It's one of the areas of unmet needs that we focus on most. And ideally then we will have an opportunity by using these tools to take the best of those new medicines in development, find the ones that are actually going to be the winners, and place our resources and effort and time on those, and take the ones that are not likely to succeed and stop working on those. So there's some tremendous opportunities in the future, as well as some short-term wins as well.
Doctor, you say the number of Alzheimer's patients is increasing. Why is that?
Well, as you mentioned in your lead-in, the number of baby boomers is increasing as we age. So we do know that Alzheimer's, of course, is an age-related disease. We do know there are some genetic factors as well. But the short answer is we don't fully know what causes Alzheimer's. We occasionally see it in people younger than 65. We more often, though, see it in those over 65. And so it is primarily an age-related disease. But this just highlights the need for more research and more collaborative efforts to delve more into the cause and the treatments for Alzheimer's.
Is there an environmental link?
It's not really clear yet. I think that there's an awful lot of work going on in many of the areas that are potentially involved. But I think our database for CAMD is actually going to help us understand a little bit better whether there's some demographic factors, some genetic factors, or some imaging factors that could identify patients that are going to go on to develop Alzheimer's. As you may know, there is a condition that's a pre-Alzheimer's called MCI, or minimal cognitive impairment. Now, not everybody who has MCI goes on to develop Alzheimer's disease. But if we can identify one of those biomarkers early on that can predict that, why we can use that information to identify patients for their own sake, of course, and then it has direct clinical applicability. But then we can also better design our clinical trials going forward, because we'll know which patients are more important to study and who's most at risk of developing Alzheimer's disease.
Thank you, Dr. Casty, for joining us and sharing such great information with us.
Thanks, it's been a pleasure.
Thank you for joining us. I'm Shannon Harris for The Record.